All right, I'm gonna assume that you are watching this video because you have neck pain that's due to a herniated disc. And I'm gonna go on to assume that you've had an MRI of your neck. The reason is you can guess, you can make a pretty good assumption about neck pain, whether it's due to a facet joint or a herniated disc with cervical radiculopathy. We covered that in the last video. But you don't know for sure until you've had an MRI. So in this video, we're going to answer the question, how do you treat your herniated disc in your neck, which has been confirmed by MRI, without surgery? Let's get into it. Mandatory disclaimer, I'm a neurosurgeon, but I'm not your neurosurgeon. And in fact, I'm not anybody's neurosurgeon. I had to retire due to shaking in my hands due to essential tremor. But I do have the knowledge, and I certainly know everything that you need to know about how to treat your cervical disc herniation without having surgery. Second thing is, I got another question for you. Do you want to live free of spine and joint pain? Well, then subscribe to our channel. We will, if you hit notify, YouTube will give you notifications about new content which helps you not only know how to treat things that are broken, but how to stay out of trouble in the first place. Before we go any further with how to treat a herniated disc in the neck without having surgery, I want to take a second to tell you at least how not to make it any worse. If you were trying to make yourself worse, which of course no one would, but if you wanted to make yourself worse, what you would do is cause additional disc herniation. So remember, a disc is herniated because the hard outer part, the annulus, is torn, and the soft inner part, the nucleus, has herniated through the annulus. So by turning your neck and crimping your neck, you can cause additional nucleus to herniate even more. You don't want to do that. I also want to talk about one thing that you can't do, and that is you can't get the nucleus to go back in. That's not how the human body works. You may in fact see some chiropractors who claim that they can adjust you to reduce the disc. That's not true. That is not true. The human body reacts to and becomes inflamed by disc material and dissolves it through inflammation. It never, ever, never just goes back in. It does go away. It literally goes away. If you did an MRI scan, you would see the disc material not be sucked back in by manipulation. You would see it be dissolved by inflammation. That's how it goes away. All right, I told you how not to make it worse. And I've told you what you can't do, which is make it retract back in, but none of that is what I promised, right? What I promised was I was going to tell you, how do you make it better without surgery? Well, there's basically 3 ways that you can make it better without surgery. And the first one is rest. Now, we talked about not making it worse, and that's certainly true. Not having impact or rotation or loading that causes further disc herniation. But we also need rest, and there's 2 ways to get rest. One is don't do anything that hurts. Baby yourself, pamper yourself, baby your neck. Another way to get rest and to protect your neck is actually to wear a collar. An Aspen collar is the brand that we have found the best for protecting your neck. They're really helpful in the car. They give you an added feeling of safety. It allows your neck muscles to relax rather than constantly being like iron cables, and really helps. Now, you can't wear a collar forever, right? It's a crutch. The longer you wear it, it offloads your muscles. It starts to cause weakness of those muscles. After 2 or 3 weeks, I don't really recommend it. And in the meantime, only when you're out of bed and up. But a cervical collar is another really good way to rest your neck. The second way is with a medication. Non-steroidal anti-inflammatory drugs are really, really helpful in reducing the inflammation that your body is bringing against the disc that is causing the nerve root pain. Remember, as we've gone over many times on this channel, nerve root pain, radiculopathy, is the result of inflammation and compression of a nerve root, and it's usually mostly the inflammation. So non-steroidal anti-inflammatory drugs, by reducing that inflammation, can reduce the pain associated with the radiculopathy. Wait a minute. You're calling it inflammation, but isn't that also reducing the healing? If the way that the disc gets dealt with by the body is that it dissolves it with inflammation, if you're anti-inflammation, aren't you anti-healing? Yeah, theoretically. But it does seem like there's a limit. There's a point at which healing is not painful, but it gets over the top and the inflammatory reaction becomes painful, and reducing that amount down into a less painful level doesn't seem to slow the healing. Maybe in theory, but as a practical matter, it's really not a concern. I would recommend, as always, that if you take non-steroidal anti-inflammatory drugs, you do it in a safe way. And that means you watch out for ulcers. If you have a history of gastroesophageal reflux disease, ulcers, coughing up blood, passing blood, you cannot go on these medications without the approval of your primary care physician. And if you don't have a primary care physician, you really can't go on these drugs. So you got to go on them safely. Everybody, whether you have an ulcer or not, I really recommend that you take Prilosec once a day, as long as you're taking the NSAID, to protect your stomach. And then last, the complications of NSAIDs, whether it's renal failure, cardiovascular complications like heart attack and stroke, or even GI complications like ulcers and reflux, they really start to go up and up the longer and the more continuously you take the medication. So if you're taking it more than a month, get off it. You need to be under a doctor's care. Make sure that you're supervised before you start getting into complications. All right, so you did the rest and you got your collar and you're waiting it out and you took your oral NSAIDs, but you don't have severe functionally limiting weakness or numbness, but it's really severe pain, and in fact it's too severe for you to live with it like that. What else can you do without having surgery? Well, you can have an epidural injection. Steroid, we talked about non-steroidal anti-inflammatory drugs. That's because steroidal anti-inflammatory drugs are even stronger. And if those drugs can be applied right at the level of the inflammation, which is in the epidural space of the neck, then they're even stronger still. So having a steroid epidural injection is a real option. Now, steroid epidural injections in the neck do come in two flavors. So think of it like chocolate and vanilla. They're two different things that are kind of similar. Chocolate, or the first one, is an intralaminar epidural. That's where the pain management doctor puts the needle in between the lamina bones of your neck and injects the steroid. That goes out to multiple levels. It's a very broad injection. Or they can do transforaminal epidural steroid injections. That's where they put it not in the middle, in between the lamina. They go off to the side and go out to where the area where the nerve root comes out and inject their steroid. So those are the ways that you can treat a cervical disc herniation without having surgery. It's not the source of this video, but I do want to tell you, just for very briefly, when do you need surgery? I know we're here because we don't want to treat it with surgery, but you also need to understand that sometimes surgery is the better and the safer option. And that was the case this week with Christina in the clinic. Here are the 3 things that you need to know that trigger someone to have surgery. The first is functionally limiting weakness. That means I'm weak in a nerve root, in a muscle innervated by the compressed nerve root. Functionally significant means if I were to stay this way forever and it became permanent, I wouldn't be able to do the things I need to do. Functionally significant weakness. And then same thing with numbness. If you have numbness, I feel like I got a club here, not an arm. If the numbness is so severe that it would limit you from doing the things you need to do, that's functionally limiting. The longer you have that kind of numbness, the more likely it is to become permanent. So ACDF surgery would be the way to go, like it was with Christina. And then the last thing is unbearable pain. If you're showing up in the emergency room every few nights like she was, the pain's just not controllable with anti-inflammatory drugs, then you really need to look into having surgery. All right, the last thing I'm going to tell you is the most important thing. I told you there were 3 ways to treat your cervical disc herniation without having surgery. First thing is, don't make it worse, dummy. At least do that. And don't go to a chiropractor who tells you stuff that's not possible. Go to a good one that helps you get better with the stuff that is. Non-steroidal anti-inflammatory drugs and rest are your friends. But there is a third thing, and it's actually the most important thing. And the reason I say it's the most important thing is, if you didn't do anything else and you only did the third thing, 94% of the time you'd get better without surgery. What's that third thing? Wait. Time is your friend. Discs almost always, 94% of the time, get better on their own. Now, they get better after an average of 6 weeks to about 85% and 12 weeks for 94%. So it takes months. It takes months for this to happen. And you can have epidural injections if your non-steroidal anti-inflammatory drugs don't work. You can have epidural injections of steroid. So there's a lot you can do to treat it along the way. But the most important thing you can do, the best way to treat it without surgery, is to go ahead and just wait. These things mostly get better on their own. It doesn't mean they don't hurt while they're getting better, they do. But it mostly gets better on its own. So as hard as it is, if you don't have one of those triggers for surgery, then give it time and wait it out. You'll get better 94% of the time.